Dr. G here from Natural Foods Diet. The FDA approved drugs. Can we be sure they're safe? Anybody else out there glad that the FDA has our back covered? Well, I don't know. Listen to this statement from the Institute for Safe Medical Practices. They came out with this after reviewing the FDA's data on adverse events from drugs. All right, and this is a direct quote. Drug therapy stands as one of the most significant perils to health resulting from human activity. I thought therapy was supposed to be good, not dangerous. Well, I found this in a report by the Institute of Medicine, and this was in 2012. And it's not necessarily an alternative medicine source of information. It was based on data from 2011, where 21,002 fatal drug reactions were directly reported to the FDA, along with 179,855 serious adverse reactions to drugs. The FDA estimates that less than 1% of adverse reactions from drugs are actually reported. And now the FDA wants to assure the safety of vitamins and herbs like they do drugs. So the drugs they say are safe kill 128,000 people every single year. Now, before the FDA's intervention, vitamins and herbs, again looking at data from 2011 in the annual report of the American Association of Poison Control Centers, found 1 death from vitamin C and 1 death from B-complex vitamin. Yes, this looks like this should be a very, very high priority of the FDA. I mean, 2 deaths is not a huge fraction of 128,000 people, but what if that was your mother? Now, maybe with the FDA's help, we can get vitamins and other supplements up to the toxicity level of drugs, and then we'll have parity. Okay, back in the year 2000, there was an article published in the July edition of the Journal of the American Medical Association. And this article stated that medical mistakes were possibly the 3rd leading cause of death in the United States. Barbara Starfield, MD, MPH, was the author of that article. And she had estimated that 106,000 people are killed each year by FDA-approved drugs. Now that number is pretty close to the 128,000 that's estimated in this 2011 report. Ironically, Barbara died unexpectedly, and the cause was thought to be a drug effect. She was on Plavix. The generic name is clopidogrel. She was placed on this drug after having had a coronary artery stent. And she died while swimming, and it was thought to be from a brain hemorrhage. Her official cause of death after an autopsy didn't attribute the cause of death to Plavix, or the drug she was taking. This points to the problem that so many people die from drug side effects, and they're officially classified as having another cause of death. Her husband, Neal Holtzman, also a physician, published an article about his wife's death in the July 9, 2012 issue of Archives of Internal Medicine. In this article, he discusses how the 2 original randomized clinical trials of clopidogrel were designed and conducted by the drug companies. They were short studies, although they did show a significant benefit on those patients that were on the drug. Later studies, though, that weren't done by the drug companies suggested that there wasn't necessarily a benefit. He pointed out that the newsletter, Worst Pills, Best Pills, had told readers that the long-term use of Plavix may be no better than taking plain old aspirin. That same issue of Worst Pills, Best Pills also talked about the potential of this drug to cause bleeding. It's again ironic that Barbara had subscribed to this publication, but the issue that talked about Plavix's lack of benefits and side effects wasn't published until after her death. The drugs that stop blood clotting are particularly dangerous, and year after year they've topped the list as the leading killers. Now I know several alternative medicine doctors that use enzymes and nutrients to prevent blood clots. And I know they have great success. I know one physician who has a very busy practice, and he's been doing this for over 20 years and has not had a single blood clot or bleeding side effect induced in his patients on this protocol. If the FDA had any common sense at all, they would realize that it would be worth a couple of studies to test this enzymes and supplements protocol against the drugs, especially when the drugs are so dangerous and cause so many deaths, and that this alternative protocol has virtually no side effects. But with the FDA and our current medical systems, drugs may only apply. Benefit and safety have no place. This is Dr. G. Thanks for watching. If you like this kind of health information, please subscribe to the channel.